Hi, my name is Linda. Welcome to my channel. Today, I will explore the basics of arthritis. If you are looking to understand arthritis better, you are in the right place. This video will explain the causes, risk factors, diagnosis, treatment, and a short description of the 8 most common types of arthritis, among many others. I am not a medical professional, and this video's information is for information only. First, I shall explain what arthritis is. Did you know arthritis is not just one disease? It is a term for over 100 different joint disorders. Here, I shall break it down for you. Arthritis involves inflammation in one or more joints, leading to pain, stiffness, swelling, and difficulty moving. It can affect any joint, from fingers and knees to hips and spine. The severity of arthritis varies. Some people have mild symptoms that progress slowly, while others may develop severe joint damage and even disability. Early detection and proper management can slow the progression of arthritis and improve your quality of life. Small steps, from lifestyle changes to treatments, can make a big difference. Ever wonder what causes arthritis? It is not just one thing. There are multiple factors that lead to joint pain and inflammation. Let us break them down. One of the most common causes of arthritis is wear and tear. Over time, your joints undergo natural stress, leading to cartilage breakdown. This is osteoarthritis, OA, the most common form of arthritis. Some types of arthritis occur when the immune system mistakenly attacks healthy joint tissue. This leads to chronic inflammation and joint damage, as in rheumatoid arthritis, RA, and psoriatic arthritis, PSA. Bacteria, viruses, or fungi can infect joints, causing septic arthritis. If left untreated, it can lead to permanent joint damage. Too much uric acid in the blood can form sharp crystals in joints, causing a painful condition known as gout. If arthritis runs in your family, your risk is higher. Certain genetic mutations also make some people more prone to autoimmune arthritis. Old injuries or fractures can increase the risk of post-traumatic arthritis, causing pain and stiffness years after the injury. Excess weight puts more stress on joints, especially the knees, hips, and spine. Unhealthy habits like smoking and a poor diet can also contribute to arthritis. Now that you know the causes of arthritis, it's key to take steps toward prevention and management. Subscribe for more tips on keeping your joints healthy. Arthritis can affect anyone, but some people are at a higher risk. Let's look at the key factors that make arthritis more likely. The risk of arthritis increases with age. As joints wear down over time, conditions like osteoarthritis become more common. Gender also plays a role. Women are more likely to develop rheumatoid arthritis, lupus, and osteoarthritis, while men are at higher risk for gout. Genetics matter. If arthritis runs in your family, you have a higher chance of developing it yourself. Extra weight puts more stress on joints, especially the knees, hips, and spine, leading to a higher risk of arthritis. If you've had a joint injury in the past, that joint is more likely to develop arthritis later on. Bacterial, viral, or fungal infections can lead to certain types of arthritis, like septic arthritis. Smoking increases the risk of rheumatoid arthritis, and can make symptoms even worse. Knowing these risk factors can help you make healthier choices for your joints. Did you know there are over 100 different types of arthritis? Let's break down the most common ones and how they affect the body. The most common type of arthritis is osteoarthritis. It happens when the cartilage in your joints wears down over time due to aging, injury, or repetitive movements. It often affects the knees, hips, hands, and spine, causing pain, stiffness, and swelling. Rheumatoid arthritis, RA, is an autoimmune disease where the immune system attacks the joint lining, synovial membrane. This leads to severe inflammation, joint damage, and even deformities. It mainly affects the hands, wrists, and feet, but can also damage the heart and lungs. Psoriatic arthritis, PSA, occurs in people with psoriasis, an autoimmune skin condition. It causes joint pain, swelling, and skin lesions, and, if untreated, can lead to permanent joint damage. Gout is caused by high levels of uric acid in the blood. These form sharp crystals in joints, triggering sudden, intense pain and swelling, often in the big toe. Ankylosing spondylitis mainly affects the spine, causing vertebrae to fuse together. This leads to a rigid posture and chronic back pain, especially in young men. Arthritis isn't just for adults. Juvenile arthritis, JA, affects children under 16. It is an autoimmune disease that can affect joints, skin, eyes, and even internal organs. Lupus, SLE, is an autoimmune disease that causes inflammation in joints, skin, kidneys, and other organs. It can lead to severe fatigue, joint pain, and even organ damage. Septic arthritis is caused by joint bacterial, viral, or fungal infections. This condition requires urgent medical attention to prevent permanent joint destruction. Understanding arthritis types can help you better manage your symptoms. Before we dive into diagnosing arthritis, I'd love for you to subscribe to my channel and click the bell icon. This way, you'll stay updated on more videos about arthritis and related topics. If you are experiencing joint pain and stiffness, you might be wondering, do I have arthritis? Here's how doctors diagnose it. First, your doctor will ask about your symptoms, family history, and lifestyle. A physical exam helps check for joint swelling, tenderness, and mobility issues. Next, blood tests help detect inflammation and autoimmune markers, indicating rheumatoid arthritis, lupus, or other autoimmune conditions. Imaging tests like X-rays, MRIs, CT scans, and ultrasounds help doctors see joint damage, cartilage loss, and inflammation. In some cases, a joint fluid test is needed. Doctors take a small sample from the joint to check for infections, inflammation, or uric acid crystals in gout. Early diagnosis is key to managing arthritis. If you have had joint pain for a while, you should make an appointment to see your doctor. Arthritis can't be cured, but it can be managed. Let's explore the best ways to reduce pain, improve mobility, and live well with arthritis. Doctors may prescribe medications to relieve pain, reduce inflammation, and slow arthritis progression. These include pain relievers like acetaminophen and NSAIDs, ibuprofen. Corticosteroids to quickly reduce inflammation. DMARDs and biologic therapies for autoimmune arthritis like RA and PSA. Uric acid-lowering drugs for gout prevention and relief. Lifestyle plays a huge role in managing arthritis symptoms. Regular exercise strengthens muscles and improves flexibility. Weight management reduces pressure on joints. Healthy diet, anti-inflammatory foods like fruits, vegetables, fish, and nuts can help. Quit smoking and limit alcohol. Smoking worsens arthritis symptoms. Physical and occupational therapy can help improve joint function, reduce stiffness, and increase mobility. Therapists also teach joint-friendly techniques for daily tasks. Assistive devices like braces, splints, or canes can reduce joint strain and improve movement. For severe arthritis, surgery may be an option. Joint replacement surgery, knee or hip, restores mobility. Joint fusion surgery helps steady and relieve pain in small joints. Managing arthritis is possible with the right treatment and lifestyle changes. Talk to your doctor and take control of your joint health today. Arthritis is a common cause of joint pain and stiffness, but not all arthritis is the same. Let's compare the two most common types, osteoarthritis and rheumatoid arthritis. Osteoarthritis, OA, happens when joint cartilage breaks down over time, leading to pain and stiffness. The leading causes include aging, most common in people over 50, joint overuse, repetitive movements, or excessive strain. Past injuries increases the risk of OA. Obesity, extra weight puts stress on joints. Genetics, family history, may play a role. OA symptoms. Symptoms of osteoarthritis include pain that worsens with activity and improves with rest. Stiffness after inactivity but improves with movement. Swelling and reduced flexibility. Bone spurs cause lumps around joints. Grating sensation, crepitus, when moving the joint. Common joints affected: knees, hips, hands, and spine. Osteoarthritis develops gradually over the years, usually affecting one or a few joints at a time. Unlike other types of arthritis, OA does not affect the entire body. Unlike OA, rheumatoid arthritis, RA, is an autoimmune disease, meaning the immune system mistakenly attacks the joints, causing inflammation and damage. Possible triggers include genetics, family history increases risk. Smoking, a major risk factor. Infections or environmental triggers may activate the immune response. Hormonal factors, more common in women. Symptoms of rheumatoid arthritis include severe joint pain and stiffness, lasting over 30 minutes in the morning. Swelling, warmth, and tenderness in joints. Fatigue, fever, and unexplained weight loss. Symmetrical joint involvement. If one hand is affected, the other is too. Joint deformities in advanced cases. Common joints affected: hands, wrists, elbows, knees, and feet. Unlike OA, RA symptoms can develop rapidly over weeks or months. RA affects the entire body, not just the joints. If untreated, it can cause severe disability, organ damage, and joint deformities. Understanding the differences between osteoarthritis and rheumatoid arthritis can help you get the right treatment early. Talk to your doctor if you're experiencing joint pain. Final thoughts. Arthritis affects millions worldwide, but understanding its basics empowers you to take charge of your joint health. While there's no cure, early diagnosis, lifestyle changes, and proper treatment can significantly improve symptoms and mobility. Key tips: common symptoms: joint pain, stiffness, and swelling. Types of arthritis. The two most prevalent are osteoarthritis and rheumatoid arthritis. Early action matters. Timely diagnosis and treatment can slow disease progression. Lifestyle strategies. Regular exercise, a balanced diet, and weight management can help reduce symptoms and improve mobility. If you're experiencing joint pain, don't ignore it. Talk to your doctor today. Small steps now can lead to a better quality of life in the long run. Thanks for listening. If you found this video helpful, please like, subscribe, and click the bell icon to stay updated with my latest content. Do you have questions or thoughts? Please comment below. I'd love to hear from you and will do my best to respond. Take care, and here's to better joint health.